Hello again, everybody. We are very prompt, aren't we, here at this discussion day. Welcome back. Hope you've enjoyed your tea, coffee, biscuits, whatever. At least going virtual VR, there is no queue for the coffee, unless, of course, you're joining us from Costa Coffee or somewhere, or Cafeteria, where the coffee is so much better. We're going to talk about overtreatment in this session. We've got a couple of recorded presentations, as you've seen this morning, and then we will have a live discussion, and then we'll repeat the poll that we're about to do now. The session is called Innovation and Overtreatment. Does the desire to innovate compromise companion animal welfare? Before I introduce our speakers, I should possibly just introduce myself for those of you wondering who the hell I am and what I'm doing here. If you weren't with us 2 years ago when we last did this live and in person, somebody thought it was a great idea to have someone who had nothing to do with animal welfare, but kind of knew about discussions to come along and do it. And I must have not made a complete mess of it because here I am again in my day job. I am a presenter on Sky Sports News and Sky News. If you were with us 2 years ago, sorry, here we are again. Time to vote on the motion for the debate. And the motion is, it's there on your screen, uncontrolled treatment innovations are detrimental to welfare. 83% agreeing so far. It's very interesting when we did do this a couple of years ago on a different subject. The change in the poll result was quite noticeable at the end compared to at the start. So we'll see what it is on this occasion. It's going up all the time as more people vote, now up to 90%, 91% agreeing with that motion. Uncontrolled treatment innovations are detrimental to animal welfare. I'll just give you a moment or two to continue voting. This actual debate follows on from our session that we had 2 years ago. I didn't chair that one, but it looked at overtreatment and when end-of-life decisions should be made solely in the animal's welfare interest. And it was said that some treatments are being offered which leads the pet's quality of life becoming secondary to other pressures, such as the owner's desire to, quotes, keep the animal going at all costs. The range of treatments available becomes more extensive year on year, often increasingly invasive. Can that be justified? So that's the background to today. So I think we're going to call that poll at 91% agreeing as it stands now, and 9% disagreeing. And it's time to hear from our two speakers, Eddie Clutton and then Karen Hum. I'll come to Karen after we've heard Eddie's recorded presentation. He is proposing the motion, uncontrolled treatment innovations are detrimental to welfare. Eddie is Clinical Director, the Wellcome Trust Critical Care Laboratory for Large Animals, and Academic Head of Veterinary Anaesthesia at the Royal Dick School of Veterinary Studies. And with all that on his plate, we're very grateful, Eddie, that you spared the time to be with us today. Eddie Clutton.
Over the years, I've become increasingly concerned with the effects of veterinary innovation on animal welfare, particularly when I found myself being compelled as an anaesthetist to participate in putative innovations which I felt did not prioritize animal welfare, nor as a corollary, the considerations of the client. Veterinary innovation is a tremendous thing when it increases the quantity and quality of an animal's life. And that's all I'm going to say, I'm afraid, about the benefits of innovation, as I'm sure Karen will know far more about this. And in any case, I've been tasked to reveal innovation's darker side. The greatest cost of innovation is borne by the animals themselves, who may experience both acute and chronic post-interventional pain, as well as suffer the acute and chronic psychological effects resulting from prolonged hospitalization in hospitals for reasons they cannot understand. This cost to the animal exponentiates when innovation fails, but is nevertheless repeated. And this failure to recognize the failure of innovation has serious and widespread consequences. If we come to accept heroic surgeries as a norm and fail to see the suffering they cause, such as that apparent in this poor dog, which featured on television some years ago, then we mislead people to think that unfettered innovation is acceptable, and in so doing, encourage its propagation. Occasionally, innovation becomes a perverse competition being applied in situations which become ever increasingly unique and indefensible ethically. Case in point is Hero, the 300-kilogram Charolais calf, who had his frostbitten pelvic limbs amputated and replaced with prostheses. The financial cost of such innovation is usually carried entirely by the client. In the case of Hero, it was $40,000 per surgery, I believe. But there are other costs too. So-called caregiver burden manifest as stress and symptoms of depression, anxiety, and poorer quality of life has been described in the owners of companion animals with chronic or terminal conditions. While moral stress is not uncommon in veterinarians compelled to be involved in innovative procedures for their career's sake, Batchelor and McKeegan found that more than 50% of respondents in their study faced at least 2 ethical crises per week, and that the single biggest cause of these were clients' requests for continued treatment despite deteriorating animal welfare and quality of life. And amongst more general societal costs, of greater concern to me is the effect that media-hyped innovations are having on society's expectations of their veterinary surgeons and on the aspirations of applicants to veterinary school, a concern which has been expressed earlier. And before going further, I think we need to examine what we mean by innovation. The word itself has warm overtones, conveying an implicit sense of optimism and progression. However, the OED defines innovation as the introduction of new things, and that something new also means something unproven or untested must not be forgotten when discussing innovations within earshot of veterinary students or animal owners. And then we have to recognize that innovations come in different guises, varying in their altruistic or ethical motives and their potential to help animals and clients, rather than the innovators themselves. At the one extreme are innovative ideas an innovator may have, in which they intend to test formally under established regulatory processes, such as the Animal Scientific Procedures Act. At the other extreme are the more worrying, unregulated, heroic, attention-grabbing, or perhaps attention-seeking acts which may be described to clients as their animal's last chance, but which are nevertheless often applied in emergency situations when there is little time for ethical analysis. As several authorities have already pointed out, there are several channels in the current legislation through which the good ship unregulated veterinary innovation can sail. In the East, we have the Animal Scientific Procedures Act, or ASPA, which regulates procedures carried out on protected animals for scientific, or less commonly educational purposes. These procedures are usually of no immediate benefit to the animal involved and may cause that animal a level of pain, suffering, distress, or lasting harm equivalent to or greater than that caused by inserting a hypodermic needle. Under the Veterinary Surgeons Act here in the West, a procedure is not regulated under ASPA if it is a clinical trial required for the marketing authorization of veterinary medicines, a non-experimental agricultural procedure, or a procedure involving animal identification. And a procedure is not regulated under ASPA if it is a non-experimental clinical veterinary practice or recognized veterinary practice, RVP. Recognized veterinary practice allows acts of clinical investigation and the management of the health or welfare of animals, providing it involves an intervention which is of direct benefit to the animal or its immediate peer group. The RCVS further advised that recognized veterinary practice consists of procedures and techniques performed on animals by veterinary surgeons in the course of their professional duties, which must ensure the health and welfare of animals committed to their care. So to my mind, the acid test for RVP is that if properly conducted under favorable conditions, it will assuredly be of benefit to the animal. And any doubt as to whether a proposed intervention constitutes RVP or is an innovation can be resolved by a voluntary approach to the RVP subcommittee of the Royal College's Standards Committee. Back in 2013, an RCVS BVA working party was convened to make recommendations with respect to the ethical review of clinical research involving RVP, so-called practice-based research. And amongst other things, the working party concluded was that ethical review should be sought for any investigation in which there was potential to cause harm or distress to an animal or its owner. For example, where the novel use of licensed medicines was to be studied, or where novel surgical techniques, medical devices, or implants were to be applied. The working group stressed that neither novel surgeries nor devices were regulated under veterinary law, and whether or not they should be part of a clinical study would be left to the discretion of the innovating veterinary surgeon. The working party went on to recommend that the ethical review of practice-based research could be conducted via collaboration or for a fee with established animal welfare and ethical review boards, or AWERBs, working in licensed establishments, or by what has now become the standing RCVS ethical review panel. However, the working party also suggested that if necessary, an ad hoc do-it-yourself ethical review board could be used. And so we have this fuzzy gap where innovators, using their own discretion, can test unregulated devices or implants with an option to seek independent ethical review, or if that does not suit, to simply set up their own review board. And if they don't want to formally test their innovation, they may ignore the RVP subcommittee, submission to which is entirely voluntary, based on their self-assured conviction that the innovation is going to be a benefit to the animal. And this is the course which the good ship unregulated veterinary innovation can take when intending to test things on animals and their clients. Clearly a gap that needs to be closed as soon as possible. And the first step, I think, is to remove ad hoc ethical review boards. One simply cannot expect independent and prejudiced review from people who are employed by the innovator. Next, the RVP subcommittee, the ethical review panel, and other independent ethical review boards must lose their optional status, and then join forces to block this course, forming an amalgam to become something that might be called, for example, the innovation panel. How this would now work is that veterinary innovators, recognizing their proposal may not be RVP, but keen to test it on appropriate cases, would approach the innovation panel, who would then, first and foremost, determine whether the putative innovation was RVP or not. And if the latter, designate it as a registered and proven method, or something like that, a RUM. The panel would then, acting as an ethical review board, set stipulations for the future application of the RUM, and in the process may consider using standard safeguards applied to animals protected under ASPR, including a harm-benefit analysis and the establishment of humane endpoints. A stipulation that board-certified specialists, such as anaesthetists, must be involved when major pain is likely if the innovation is applied would be another consideration. The use of RUM in client-owned animals would require that the client was made unequivocally clear that they were not consenting to another treatment option, but to an untried therapy which had temporary authority for use from the Royal College of Veterinary Surgeons. And finally, there would be an ongoing audit of the RUM, with a mandatory reporting of all results, good and bad, and in particular those affecting the animal's quality of life, until at least that time a consensus existed that the innovation was useful and should become RVP or be banned. And because innovations are often required in emergency situations, I would propose that the innovation panel consider forming a means of approving innovations retrospectively, that is, after their first emergency application. And in this way, I believe the profession can capitalize on the opportunities of innovation, but in a way that above all ensures our constant endeavor to maintain the health and welfare of animals committed to our care, and with the informed approval of our client. Thank you very much.
Thank you, Eddie. And unlike the rest of you, I had the opportunity to watch Eddie during his own presentation, and he was watching with a very critical eye, I can tell you. Eddie and Karen will both be answering your questions once we've heard from Karen with her recorded presentation. So do get those questions in. Go to the stage section, as we're doing this morning, to the right of the screen, click on that Slido tab, upvote any questions that you see on there that you would particularly like to see answered today. We'll get through as many as we sensibly can in the half hour or so that we'll have once we've heard from Karen Hum, who's going to oppose the motion. Karen is an associate professor, transfusion medicine and emergency and critical care, Royal Veterinary College, RVC. She's also the co-head of the emergency and critical care service at the Queen Mother Hospital for Animals. So another very busy professional to whom we're grateful for her time today. Karen Hum.
My name's Karen Hum, and I'd like to say thank you so much to the Animal Welfare Foundation for inviting me to speak in this forum on innovation and overtreatment. And I am going to talk today about cases I see in our intensive care unit. And we see a lot of innovative treatment there. So I'm going to oppose the motion that uncontrolled treatment innovations are detrimental to animal welfare. What I'm going to do is go through what veterinary innovation is, how it differs from experimentation, how we can determine if an innovative approach is correct, and then talk about the benefits of innovation that can occur. I just want you for a moment to think about what veterinary innovation means to you. And I think for many people, they might think about the use of new drugs, or perhaps particularly surgical techniques, maybe new products. And I think a lot of people worry about innovation being a tempting treatment when prognosis is deemed poor. And I think innovation for me is all of these things and more. And I think innovation, when it's done well, is actually progress of the veterinary profession. I want to show you this cat who came in not that long ago to our intensive care unit. And if you look at the ECG at the back that someone's pointing at now, you can see the electrical activity of the heart, and you can see the electrical activity has stopped. That means the heart has stopped. The beats are starting to return slowly now, and this cat is coming back, but you can see that this is massively affecting this cat's life. Its heart is stopping, and it's having episodes where it's essentially collapsing. It can't function properly, and this was happening really frequently. So again and again throughout the day, this was happening, and it couldn't have a decent quality of life. What we did was we placed a pacemaker in to give artificial electrical activation of the heart, and that cat then went home to live a normal life. A few decades ago, this would have been unthinkable, but this is veterinary innovation in action, and you can see how it's led to this cat having a decent quality of life. I think it's important to think about the difference between innovation and experimentation. And because I work at a veterinary hospital, we're dealing with students the whole time. And how do you learn as a vet? Well, often you can think about this as this experimentation. You can see the students practicing physical exam on the right, learning about how to take a blood pressure. And these are on patients. And are they experimenting as they learn? Are we experimenting as we innovate? Well, actually, the Royal College of Veterinary Surgeons have clear guidance on this. In our code of conduct, we have a point where they differentiate between primary practice, veterinary practice, and research experimentation. And the code says that we have to think about the purpose of the intervention. Is it of direct benefit to the animal, or is it or its immediate group? If so, then it's recognised veterinary practice. And in this way, I think we can say that innovation is not experimentation, because we're trying to benefit an animal or its immediate group. I think really what's very, very important, now we've thought about the difference between innovation and experimentation, and my view of innovation as progress of the veterinary profession, is to make sure we focus on this aspect of welfare and how we judge whether innovation affects welfare. Who judges this? Can a vet who's making a decision of whether or not to perform an innovative practice judge alone? And maybe actually we really ought to be thinking about the whole veterinary team considering a case where an innovative practice is being considered. I also believe that owner should be involved in that decision. And in an ideal world, really, we'd have an ethics team that would be able to help. In bigger practices like the Royal Veterinary College where I work, we might be able to have an ethics team within the practice. But in smaller practice, it would be so helpful if we could have an ethics team that could come in and chat or give advice about innovative procedures. And this is so tricky because we really need to think about each case individually and each animal individually. So both the innovative procedure and the individual animal. How do we decide whether this innovative treatment is worthwhile for that patient? We can think about how long maybe a patient is going to have to stay in a hospital for that procedure to occur, because for some patients, hospitalization itself is extremely stressful, but for others it isn't. We can think about what we're aiming for. Are we aiming to get a patient home to spend some extra time with their owner? Or are we aiming for an extended lifespan? How long is required? How long as a lifespan is required to justify a procedure? For me, is a really interesting, debatable point. We can think about quality of life. It's not just about lifespan. We need to focus on quality of life. Is a shorter, good quality life more important or valid than a longer period of time where quality is perhaps impaired to some degree? And again, I come back to this aspect of the owner's wishes, to me, being very, very important in helping to make a decision about whether an innovative procedure should be performed. I do sometimes get frustrated when people talk about the welfare aspects of innovative treatment and innovative veterinary practice, because for me, welfare issues are all around us. We can think about welfare issues where owners are not providing the care they should for their pets, and the veterinary profession is fairly good at dealing with that and aware of that. But actually, in standard, routine, everyday veterinary practice, very basic procedures can have massive welfare impacts. Often people focus on things that are innovative rather than maybe thinking about the much more frequent procedures, such as perhaps neutering of animals, that's done as a routine. And people so rarely talk about the welfare issues that can occur there. Or perhaps an animal that has a terminal life process and disease and has a feeding tube placed because it's no longer eating. And is that fair? You know, these are very basic procedures. Placing a feeding tube is not innovative, but has massive welfare implications in that particular patient. So I think maybe focusing just on innovation, which may be a very, very small proportion. Well, I'm not saying that it's not valid to do so, but I don't think we should focus exclusively, or perhaps to the degree that we do, on innovative procedures when considering animal welfare. You know, it's really important. I come back to this ethics issue about how we assess and deal with welfare concerns. I think it's really important to think about the benefits of veterinary innovation. They're all around us. I showed you the cat before as an example, but I could give you lists and lists of the benefits of veterinary innovation. I've got a picture here of a drug, tranexamic acid. This drug can be used to treat dogs with lungworm. We didn't know that a few years ago, but now these dogs which have problems with bleeding and can die due to blood loss, actually we've shown that this drug, through innovative use, will help treat that. We have animals like bulldogs with brachycephalic obstructive airway syndrome. This means they've got too much tissue and around the back of their airway, which obstructs their breathing. And they can have really poor welfare, but we can perform some surgery to remove some of that tissue and deal with it. And actually then their welfare is hugely improved. In the past few years, we've also started removing the pituitary gland of some diabetic cats. So this is a hypophysectomy, and that allows diabetic control in a select population of diabetic cats. So after the procedure, they don't have to have daily injections or more frequent injections of insulin, and their diabetes can sometimes go into complete remission. There are so many techniques and prognosis that have been improved through pushing the boundaries and innovation. One that really makes me, I think of quite a bit in this situation, is grade 5 spinal disease. In dogs that cannot sense pain in their legs due to spinal disease, I was taught as a veterinary student that these patients had a hopeless prognosis and that we shouldn't attempt treatment. But because of innovative procedures and vets pushing the boundaries, we've found that actually that's not true, and we can treat them successfully. So pushing the boundaries and trying harder with some cases allows us to progress an animal's welfare to improve. I want to think a little about why we're treating a patient. And this really, again, is coming back to our welfare aspect. Why are we doing an innovative procedure? Because we can be something that we talk about, and perhaps like Everest, why did we climb it? Because it was there. It sounds like an egotistical reason, but perhaps with these ideas of treatment because it's possible allows us to learn from patients and improve welfare of hopefully that patient, but also others going forward. As I said before, I think it's really important to consider the owner's needs and the owner's feelings about a pet and their welfare. And then I think really, as we've discussed already here, and I know Eddie will be discussing as well, we need to think about how the patient's quality of life will be affected and how we want to improve that, though we know that it's very difficult to judge. I hope through showing you my idea of innovation, I've tried to convince you here that uncontrolled treatment innovations are not detrimental to welfare. Welfare issues for cats and dogs are all around us. And it's easy, as I say, to focus on innovation, things that look different, things that seem new and potentially often are quite expensive, and focus on those as welfare issues. But really, I think we need to look at all aspects of welfare. And when we're considering innovation, see the potential benefits there and the progress that can occur, which actually would lead to better welfare for so many animals. Thank you ever so much for your time, and I look forward to discussing this further with you.
Karen, thank you very much indeed. I can tell you that Karen Hum was also watching her own presentation with a very critical eye. Thank you both for your recorded presentations. Thank you for all of your questions that have been coming in. You'll be seeing them on your screens. If you want to ask a question, go to the stage section on the right of the screen, click on the Slido tab there. And if there's a question there you particularly want to see asked and debated, then do keep upvoting those questions. So let's start with a question from Maggie Roberts. Should an owner's wishes ever override the animal's welfare? I suspect ever might be a key word there. Eddie?
No, not if you're a member of the Royal College of Veterinary Surgeons, because, above all, our commitment is to the health and welfare of animals. And whilst there is an element of the declaration that commits ourselves to the client's wishes, our priority is animal health and welfare. And whilst, obviously we have to accept the client's wishes, but the veterinarian there principally in the United Kingdom is there to protect the animal. It's different in the United States, where this prioritization to the animal isn't as a part of their declaration. And I think part of this feeling that clients should have more say is based on an American innovation, no, possibly the wrong use of the word, American idea, but their ethical basis to veterinary practice is different. There is no priority to animal health and welfare, which is in the United Kingdom under the RCVS. So yes, the client should be listened to, but not prioritized.
Karen, you're going to have to take yourself off mute. There we go. Well done. How do you want to respond?
Yes, I think, so I really think it's so important to listen to what the client has to say, and welfare is inherently subjective, and we do very much listen to our clients, whether we realize we are or not, and take their circumstances financially, emotionally into our decision making, whether we realize we're doing it or not as practitioners. And so almost to pretend we're not is false. Yes, they shouldn't override it. If we have a clear evidence that an animal's welfare is being compromised, no, we shouldn't make a decision based on an owner's wishes. However, they are part of the discussion, because that owner is going to have to deal with that patient. And if they're taking the animal home with no desire to treat them with what you've done, then obviously that doesn't work. On the other hand, if they are very, very keen and very, very committed, something may be possible to maintain an animal's welfare that may not be possible for another client. And that's why it's so important to involve them in the decision. But yes, absolutely. You can't say that I think an animal's welfare would be poor, but this owner really wants the procedure to be done. No, that's not acceptable. But I feel like those kind of very black and white decisions are not common.
Okay, thank you for that. Go on, Eddie.
Well, I was going to say, they actually are common, Karen, because Dorothy McKeegan's research showed that this was the biggest cause of moral stress amongst veterinary practitioners, is clients wanting to continue with treatment, which the veterinarian did not want to continue with. So it is common.
Karen?
I suppose I feel like in those circumstances, I wonder how much is communication. And so really what I feel like often is that we as a profession don't necessarily communicate our understanding and our explanation of what's going on with an animal. If we can communicate that better, then perhaps owners aren't necessarily going to be so keen to push things which we feel aren't appropriate. So absolutely, it's a stressor for veterinary practitioners. But part of that means that we need to explain better what's going on. And if an owner totally understands the welfare of their pet and the worries of the vet, I think at that point we're probably going to have those issues happening less frequently. And so many aspects of veterinary practice come down to good communication. I really feel that's one of them.
Okay, I can see Eddie slightly harumphin', but Eddie, you get a chance, I'm sure, to come back on some of that when we discuss some of the other questions. There's lots to get through. I just want to move on to one from Nicola Clements, who says, do you think the emphasis on gold standard care predisposes owners to expect and vets to recommend over-treatment? Eddie?
Well, it depends entirely on what is regarded as gold-plated veterinary treatment. This is a concept that I was not exposed to as a veterinary student myself, but it has been introduced, and it's established, my understanding is, in some veterinary schools as a sort of a complex construct based on complexity of treatment and its cost, rather than what is the point of doing any treatment at all, which of course is to purchase an animal's quality of life. And if that involves death, paradoxically, then that's what we do. So the notion of gold-plated, I think, needs to be attacked. Actually, no, let's define it first and then attack it, because I suspect it's an unethical and not welfare-based construct, which is being promoted amongst some veterinary schools.
Go on, then. This is really important that we define this and we agree on it. So just really briefly, Eddie, define it for me, and I want Karen to do the same.
Gold-plated treatment, probably the most expensive, but it's that which involves the most extensive, the latest, the most complicated treatment options.
Okay, Karen?
As a package.
I would say actually it's more to do with working up a case effectively and working out exactly what the problem is with that patient and then giving the best possible care. Yeah, I can add more, but do you want just the definition?
Go on. I want to make sure everyone gets an equal time. Go on, Karen, you carry on. I'll come back to Eddie in a minute.
So what I think there is a real problem with trying to always attain gold standard treatment. And again, there is research in this area and actually showing it's very stressful for vets, again, especially when they've come from recently graduated, they feel like they always should be offering this to their clients who either can't always afford it financially or emotionally don't want to go through that. I feel like that there's not necessarily so much of an ethical issue in terms of welfare necessarily with this. It doesn't, to me, gold standard care doesn't always involve doing innovative and progressive treatments. In fact, often gold standard is evidence-based, and evidence-based won't necessarily involve those treatments.
Eddie?
So then it's possible for euthanasia to be regarded as gold-plated treatment?
Well, I think essentially to me, gold standard is, working it up effectively and then just considering the best options, including for that patient. And absolutely, you're right, Eddie. Euthanasia is often going to be considered there. But what can cause stress is not necessarily being able to go through all those steps. The owners can't afford it, and then a vet having to make a decision with maybe limited evidence. But sometimes you just have to be pragmatic, and recognizing that is important.
Let me move on to another question, because we've got lots of them. Keep them coming in, and keep upvoting the ones you want to see. And so this one is anonymous. Do say who you are if you feel you can with the questions, but as you see, it won't stop us asking them. Does innovation and advanced surgical technique undermine the need to breed responsibly, Karen?
Yeah, I think that's such an important question. One of the ones that I spoke about in my presentation was dealing with the brachycephalic dogs, which I find heartbreaking. I see them pretty much every week in our ICU, and I find them very hard to deal with. So do I feel that by treating them, we're encouraging the breeding? No, I don't, because I think those owners generally who go through both the financial and the emotional stress of having their animal go through that procedure probably are great advocates for saying that they would prefer the breeding quality to be improved. No, I don't, essentially.
Eddie?
No, I agree entirely with Karen on that. But there again, I think the veterinary profession needs to be far more aggressive in stopping the breeding of these animals which require surgical intervention.
Yeah, I think it's really, sorry, Eddie, just to jump in there. I think saying to neuter those animals every time we do a procedure like that. So there are some RCVS guidelines in terms of, an animal can only have a certain number of cesareans before they have to be neutered. But I think perhaps if we're having to do procedures because of breed-related issues, whether we should be more aggressive in saying those animals have to be neutered at the time is an important consideration.
Okay, let's go to another anonymous question. Keep the questions coming, getting lots of them, try and get through as many as we can. This one is, how do we ensure that euthanasia continues to be considered treatment choice to prevent, a considered treatment choice to prevent suffering, rather than viewed as failure to manage a case? We just talked about euthanasia. Eddie?
It's an excellent question. It comes back to, I think, to veterinary education. My experience is now that because the veterinary schools are populated with so many innovators, the perhaps old-fashioned notion of euthanasia being what it is has been lost. And this idea that it is a signal of failure has been lost on the veterinary students, and it needs to be resurrected. I teach euthanasia is the most long-acting and effective analgesic known to the veterinary profession. And of course, it is our legal prerogative to use it to end animal suffering. And I find it, paradoxic that people are using or choosing to not use euthanasia at a time when the human population is using it more and more, or demanding it more and more.
Sorry, Eddie, just to be clear, are you saying that students they're coming in with a bigger problem with using euthanasia than used to be the case? Is that what you're saying?
I think they're graduating with the idea that euthanasia should be avoided at all costs and not be part of. And part of the reason for that is the specialization of all the subjects. And this is a topic close to my heart, is that to be credentialed in surgery, oncology, medicine, or anesthesia, none of your case reports submitted to the specialist colleges allows euthanasia as a therapeutic option for animals. And I think that's a huge deficiency.
Karen, what do you think?
I think it's probably fairly vet school dependent in terms of how well or effectively euthanasia is taught as a treatment option. But certainly vets in practice are still very pragmatic and making those decisions. It would never be seen as a failure as far as I was concerned. I don't think in general we're looking at the patients we're talking about innovative treatments for. Euthanasia should always be discussed with those if that is a sensible option for them, and that the option be given to the owners and explained thoroughly what the risks are, etc. And I think that's one of the really important, I suppose, when I'm coming back to owners again, good communication, good owner understanding of the issues that are going to be involved in any innovative treatment, the risks involved, and giving other options, very much including euthanasia, is really important.
So does more need to be done in the field of communication? It sounds like it does.
Is that for me or Eddie?
Either of you.
Oh, I would say yes. I think communication is shown to be a massive issue for the profession, causing stress for vets and stress for clients, and that we really need to improve our methods. If you look at complaints to the RCVS, a huge proportion involve poor communication. And so if we can improve it there, then we can improve it at every level of veterinary practice. And definitely, if we're talking about doing procedures which are pushing the boundaries, those owners need to be so well informed and know exactly what's going on.
Ed, you got anything to add, or if you haven't, I'll move on to the next question.
Move on to the next question.
Yeah, okay. This is from, forgive me if the pronunciation wrong, I'm going to attempt it, but I'm going to have to guess what part of the world you come from. So I'm going to try Eva Gaida, but that could be horribly wrong. If it is, I apologize. Because we can doesn't mean we should, because the insurance will cover it. Let's try. Karen.
Very much. And I put because we can in there somewhat provocatively in my own statement before. I think we need to be careful and, as I say, consider each case as it comes. And I really loved what Eddie said about in terms of the ethics issue. My worry is that we are looking at potential innovative uses of drugs, of surgical techniques, tweaks, so frequently that it would be very hard to go through an ethical board for every single one. And so we need to have some kind of self ability to judge ourselves. But yes, very much because we can doesn't mean we should, but because we can, to me, means so often it should be considered. And that may be discussed, and as I say, with all those people I've talked about already.
Eddie?
Yeah, because we can, should we? And categorically not. Particularly when the outcome, we haven't mentioned this at all, but when we talk about success in an innovative intervention, are we talking about the ability of a dog to walk a bit better or a cat to breathe a bit better? Or are we talking actually about what we should be aiming for is the animal's quality of life? And it's not discussed when, the option to do something, if it's not been done before, i.e. it's innovative, how have we any way to predict the animal's quality of life? And how can you communicate that to the client? You don't have to use the word experiment, but you have to say it's not been done before. And, coming back to my presentation, if it's not been done before, you cannot predict that it is going to benefit the animal. Therefore, it is not RVP.
But at some point, I'll let Karen come back in, but I'll just ask the layman's question. At some point, your veterinary science will never advance unless you try something that hasn't been tried before.
Oh, yes, we just have to find the way to allow it to advance without compromising animal welfare. And that's having some sort of, review system, as I said, is to close the gap between the RVP subcommittee and the ethical review board.
But you still have to, at some point, intervene on an animal in a way that hasn't been done before.
Yes, but you stipulate what is required then. So if you're doing innovative major surgery, let's say, then you have somebody who is a pain expert there, or somebody who's aware of what the consequences of this might be to the best of their ability. And by all means, I'm not against innovation, I'm far from it, but it needs to be far more controlled and not at the whim of individuals who think this is interesting to look at.
Karen, is it at the whim of individuals who think it's interesting to look at?
There is, at the moment, the veterinary profession doesn't have the ethical regulation that Eddie describes, and I think could benefit from, definitely. And it does rely on self-control and self-regulation. probably too much. Having said that, as I say, it's got to be a balance somewhere between how much you can allow a vet to self-regulate. Can we say they can't self-regulate at all? Can we say you can never use a drug off cascade without putting it through an ethics review? Sorry, off cascade being using it in a way that it's not been licensed to be described to do. For example, like the drug I talked about in the presentation, using it for a slightly different procedure. I think there has to be a balance somewhere, and allowing some form of self-regulation is important for the profession. We need it in every single way. Sorry, I can see Eddie wants to come in, but like I do want to come back again to the idea that really it's not just about innovation here. Really, this is actually a very small proportion. I'm thinking far more about far more common situations that are happening every day in practice where animals' welfare is compromised by very basic procedures. Sorry, Eddie.
No, Karen, I just wanted you to address one more question, and then we'll let Eddie come back in, because it's kind of linked to what we've just been talking about from Michelle Campbell. What are your thoughts on the value of predefining endpoint criteria when innovative treatments are undertaken, e.g. to help assist client expectations, Karen?
Yeah, so important. And I think often that can be we'll just try, for example, if an innovative operation is performed, well, oh, actually, it hasn't quite worked, but maybe we can just do one more procedure or give it one more day. And it's very easy for both owner and vet, who are both so involved and so have so much put into a patient, that they find it hard to step outside and decide when it's time to call it a day. And so I think, yes, that kind of plan, and again, it's down to communication with the owner, is so important. That's a great kind of idea for making sure welfare is maintained.
Thank you, Karen. Eddie?
Well, yeah, in answer to the second question, humane endpoints are absolutely critical, I think, to testing to ensuring that animals who are the subject of innovation are not caused to suffer by it. But let's just come back to sort of the question, which is, does innovation compromise welfare? Well, many of the examples that Karen's used, including the drug, are never at risk of compromising welfare. I think let's focus our attention on those where an animal may suffer as a result of the innovation. So we're talking specifically about surgery, oncology, and possibly some aspects of intensive care. We're not talking about a good vet thinking entirely appropriately that this drug off-label is likely to have a beneficial effect. That's an innovation which is not questionable in terms of ethics. It's the ones where there is a real risk of an animal suffering that have to be focused on and regulated to a much greater degree.
Karen?
Yes, I understand, but then if we're talking about, then I think we're talking about very, very small numbers, actually, when we're looking at that, and perhaps they are the specifics that should go to more ethical assessment. And there are cases where the RCVS have been involved in particular ethical issues in that way. So and then I come back to I don't want to overplay this, how big is this welfare issue? Always, any animal where their welfare is compromised, we should be considering. That's part of our job. But as I say, I feel like somewhat there are bigger fish to fry.
Okay. Let me just ask you about the ethical issue. Are veterinary graduates, I'll start with you, if I may, Eddie, are they adequately trained in ethics and animal welfare? Is that sufficiently part of what they're learning?
No, I don't think so. There's a paper in the Vet Record a couple of years ago looking at the training of ethics in veterinary schools, and I think there's only 2 or 3 which sort of achieved any level of education in this area. And welfare, of course. I left vet school thinking I knew everything about animal welfare until I started talking to people who did know something about animal welfare, and I realized I hadn't been trained at all. And the same is true of ethics. So particularly in these areas of sort of the attractive elements of the veterinary curriculum, like surgery and medicine, that's what vet students went to vet school for, and that's what they want to do. They don't want somebody telling them that maybe they should think about these things before they decide to specialize in them. So no, I don't think, from my own experience, students are invited to discuss these things as openly or as extensively as they should be in preparation for practice.
Okay, I want to try and rattle through a few more questions. If you wanted to add anything to that, Karen, do so. But I want to throw a particular question at you from Mark Evans. Do super vets suffer a conflict of interest between their ethical responsibilities and their need or desire to keep their high-cost businesses profitable?
No, I don't think they do, actually. I think you've got enough business in terms of need for referrals. Most referral centres are absolutely slammed at the moment. I don't think they have a need to increase, to push boundaries to make money. You could argue whether there are other aspects which affect, and Eddie touched on this in his presentation, whether there are personal aspects about trying to push boundaries that affect how people work, but I don't think it's a financial desire. Often innovative procedures are actually loss leaders or loss making.
Eddie, conflict of interest for super vets, do you think?
Yeah, I think, yes, there is a conflict of interest. People who want to innovate, and again, I'm coming from an academic perspective, but innovation is highly motivational and highly rewarded in vet schools, in vet school academics, because it elevates the profile of the school, it engages the students. And that's why I say, there is this growing discrepancy between what is being taught as sort of the leading edges of veterinary surgery, veterinary medicine, and veterinary ethics. It's an increasing gap which needs to be caught up. So yeah, I do think there's a conflict of interest in financial. There is a lot to be gained from being innovative, and finance is an inescapable advantage.
Here's an interesting question, which has just moved on my screen. There it is. In your opinions, in possible cases of innovation-associated overtreatment, is this mainly driven by individual clinicians, client pressure, or other factors? Karen?
I think client pressure is definitely there. That's got to be a huge proportion, and certainly we get asked about procedures that we don't do, that are done in other countries, and there are owners who will travel abroad, who will do everything they can to try and preserve their pet's life. I think probably actually that is one of the main drivers. There are some clinicians who are very keen to push the boundaries and see what is possible, but I think actually push more comes from clients, actually. If I'm thinking about unethical push, what push which maybe would be deemed not feasible from a welfare point of view, I would say that's client driven. I don't know if Eddie agrees there.
Eddie?
I personally, I'm not in a position, because I never met clients for the last 20 years. As anaesthetists, we're not allowed to speak to them.
Fair enough. Let's pick up one question from Nicola Clements. I think this might be quite a good summing up in a way. So if you agree, Karen, should the standard be contextualized care, best for owners and best for the animals? A lot of definitions will be required, but as a basis.
Yeah, very much. That sounds fantastic. We're trying to do the best for everyone, but as we come right back to the beginning of first question, what Eddie talked about, the animal welfare does have to be the paramount.
Eddie?
Absolutely right. Contextualize every single case, but prioritize the animal over the client. Okay.
Let me give you both a chance then to summarize your arguments, and then everyone will get a chance to vote again on the motion on the screen. But thank you all for all your questions, which provoked, I think you'll agree, some very lively debate. Who wants to go first? Should we do ladies first? That's terribly old-fashioned, I know, but I think it's still allowed. Karen, 1 minute to sum up your arguments.
Okay, I'm not sure I need a minute, but basically I think for me this is about perception, and I think to some degree Eddie and I are talking about the same thing and agreeing, but my perception of innovation is perhaps slightly different to his. I think of innovation as progression of the veterinary profession, which can massively improve animal welfare, both for the individual that happens, and the population as a whole. I do worry much more, as I've said, about welfare of dogs and cats at a much more basic level, not at in innovative situations. And we do need to consider how we can produce a more effective ethical overview procedure, as Eddie's described, for the profession and practitioners, which all vets and vet nurses and probably everyone working within a veterinary practice can access, either to create a process when a process has been described or during a process. Yeah, I think therefore actual innovation itself is not really the issue. It's the practice of the innovation potentially, and that's the real crux of the matter.
Thank you. I think you used your minute. Eddie, your turn.
I'll come back to what I originally stated is innovation means something new. And if there's a very high likelihood that it's going to benefit the animal in terms of its quality of life and the client, then there is no real discussion in the minds of an honorable veterinary surgeon. You go ahead and do it. It's where the innovation is something unproven and untested and is applied in the off chance that it will produce a benefit. That makes it a non-regulated, a non-RVP, and which needs, therefore, intervention and regulation from an external adjudicating panel, something like that. So it's where, I'll come back to the whole point, innovation is good if it benefits the animal, but where there is a doubt about its potential to help the animal's welfare, then it's not an automatic progression. It needs review and regulation.
Thank you very much, Eddie. I think I can say on Karen's behalf that she didn't like the phrase "on the off chance" there, but thank you both very much indeed for a very stimulating debate. Thank you for all your questions. Last chance to vote. As you can see, if anything, the voting has gone even more in favour of those agreeing with the motion, but only marginally. Remember, the motion is uncontrolled treatment innovations are detrimental to animal welfare. 90, it's going to be even more, 92%. I don't think it's going to change very much from that. So the motion is of 93%. If I keep talking, it might go to 100, but let's accept that it's a little over 90%. Thank you all very much indeed for voting, and in particular for the questions, which were clearly very stimulating. Thank you in particular to Eddie and to Karen for their time in preparing their presentations and for the debate as well. And I'm going to hand over to Fiona Fell.